Nigeria is set to receive about 80 million doses of COVID-19 vaccine to immunize 40% of the population this year. Chairman of the Governors Forum, Fatoye, revealed this as part of measures being put in place to curb the spread of the virus, adding that another batch of 60 million doses are expected to arrive in 2022. Fatoye, who is also the governor of Ekiti State, southwestern Nigeria, said the quantity of vaccine being expected was disclosed by the National Primary Healthcare Development Agency. He, however, said the Governors Forum remains a strong proponent of the use of public-private partnerships to procure the vaccines as a means of closing the gap between what is available and what is necessary to achieve herd immunity. Joining me on the news to discuss this is the medical doctor, Benard Fatoye. Good to have you, Benard.
Thank you for having me.
Welcome to News Central. All right, so experts say 60% of the population is required to immunize to attain herd immunity. With what Fatoye, governor of the state, has said, Nigeria won't hit the mark of herd immunity until next year. What are the implications of this?
Well, the implication of this is basically it's simple. It means that there's to still be status quo to that point in time where we're able to achieve herd immunity, which of course, like you said, is put between 60 to 70%. We are not even sure, but just around that number. And by what you also say, it means that we can't get to this percentage till next year. So it's clear it will still be status quo. When I mean status quo, we still have to wear our masks and the other measures that have been put in place. Until we get to that point, we cannot take a step back.
All right. The governor of Ekiti State, Mr. Fatoye, has also suggested that each state should set up its own CDC agency. How practicable is this?
Well, how practicable? I think it's something that can be done. But maybe we should look at it from the angle of why is it saying that, and do we have agencies that perform those functions at the moment? The truth about it is that the way Ministry of Health, State Ministry of Health have programmed to work, they all have a department that does the function of the CDC, usually in the name of Public Health Department or Epidemiology Department. So what we just need to do is to ensure that all state ministries, these departments, all the state ministries are well funded. Probably we might begin to look at, is it possible for us to give them more autonomy and make them a separate parastatal on its own? But there is something that functions as a CDC in every state. It's just about how effective have they been over the years.
All right. So speaking from a doctor's point of view, what do you think the healthcare system will deliver as concerning the vaccine doses effectively and speedily? What do you think it will take for vaccine doses to be effectively and speedily delivered? Truth
be told, in terms of delivery, I might say Nigeria and probably some other African countries might even have a better edge than advanced countries in terms of vaccine delivery on a massive scale, because we just about finished eradicating polio. That took a lot of drive in terms of vaccination, especially into the interiors. So there is that structure on ground for us to build on. So it's something that can be done. The only rate limiting step that seems we need to just fine-tune properly is the cold chain issue, especially when you're talking about vaccines like the Pfizer vaccine that needs about minus 70 degrees Celsius and all.
All right, so do you think Nigerians would succumb to this? Do you think they will be willing to take the vaccine doses whenever it arrives?
Yes, a lot of conspiracy theories, but it's not something, it's not particularly Nigerians. And I probably think it's more of a public health problem also in the US than it is here. A lot of campaigns going on by people that feel like the vaccines have something else attached to it than us. So, and I've seen quite a number of information circulating on social media. Of course, we've seen that government is trying to be proactive and trying to educate people even before the vaccine comes, to make them understand that this has nothing to do with someone trying to play with people's life, and that's also one of the reasons why they said one of the first people that will get the shots publicly will be the president, vice president, and all that. So eventually, yes, just like every vaccine, we're going to get that resistance from people. But like I said, Nigeria can always leverage on the structure on ground for mass vaccination programs like polio. We're already used to using traditional leaders, religious leaders to persuade people to getting this vaccine. So I don't think it will be much of a very big problem.
All right, thank you so much, Mr. Benard. It's nice having you.